Hello, gentlemen. I know it's been hard to meet recently, and I wanted to give you an update on what we've been doing with regards to the borderline change research study. And so Pat suggested I make a brief YouTube video, and so I'm just going to show you a little bit about what we're doing and how we're doing it. So the first thing we're doing is I'm actually downloading data from the EDW from three distinct Otter tables. One is the comments table, which is like the progress notes from Otter. One is a documents table, which is the radiology, pathology, and doctor's notes. And third is a medication regimen, which has instances of when patients were prescribed certain medications. And we put them all, what we do is we combine all the information in these tables into a single table called a data points table. And in abstract, this table is supposed to be an extremely generic, highly scalable table that contains just a few columns, but ultimately billions of rows. And each of the columns, as you can see here, there's a patient ID field, there's a start date, there's an endpoint, and there's a data point field. And then there's also a data type field that describes the data point. And that's it. So ultimately, data points we're thinking are going to be things like blood pressure or acute cellular rejection, or even things like demographics like race or ethnicity, whatever. Everything becomes a data point, and some things are going to have start dates, some things are not going to have start dates. It doesn't matter. What we're doing right now, instead of having atomic data points, I'm actually just considering a single document, a single comment, or a single medication regimen to be a data point. And then what we do is we Lucene index this entire database, this single table, this single data points table, and make all this information available for searching. And so I created a bit of a web interface here to sort of demonstrate what we can do and with regards to searching. So here in the first field, I'm going to search for borderline change. I want to find patients that have a diagnosis of borderline change on biopsy. And so I'm searching for borderline changes, or borderline rejection, or borderline acute cellular rejection. And I'm choosing to search in the documents, or in the data points that have a type of documents or comments. Ultimately, this type will be something like kidney biopsy results. But right now, I'm just including, again, I'm just throwing in the whole documents into the data point. And so it's going to do a full text search of all of the data points that are documents or comments looking for a borderline change on biopsy. And so if we do that search, we get 247 patients. And if we click on one of the patients that's returned, what I'm doing now is representing this patient in a very simplistic manner. It's just basically a chronological listing of all of the data points that are related to this patient in the database. So I just organize all the comments, all the medications, and all the documents chronologically, and then display it in a single HTML window. Not the easiest to navigate, but it's at least comprehensive, and everything should be there. And it's one way of organizing all the information we have about these patients. So part of the borderline change study is determining whether or not these people with borderline change were treated with steroids in order to try and prevent progression to acute cellular rejection. And so what we can do in the search window is we can say, I'm going to look for a second exposure. I'm going to look for someone, and again, probably this is not how we're ultimately going to do it, but there are many different ways that I have found in the chart, quote unquote, that indicate the person has been treated with steroids. So, for example, there may be a comment in the progress note saying, Solumedrol, or Medrol, or methylprednisolone, or taper, or prednisone, or steroids, or pulse. Or there may be a medication reference to 2668, which is Solumedrol, or 6606, which is prednisone. And so we want to search all the data points that we currently have, which are the documents, comments, or medication regimen, for any reference to this, any reference to any one of these tags. But we want to do it such that we only want to find patients where references to these things occur 1 week after their diagnosis of borderline rejection. So many patients may have references to Solumedrol on their chart, but we want references that only patients where the references is in temporally related to a diagnosis of borderline change. as entered in the first exposure. And so if you remember, there were 247 patients with borderline change, and if we do this search, we come back with 150 patients, and you can see here is the exposure 1, borderline change. Here's the exposure date. In this case, it's sorted by date of exposure date. This is September 2nd, and this patient on September 3rd received putatively some dose of steroids. And so all that information is here: exposure 1 and the date, exposure 2 and the date. Now finally, what we can also do is we can enter an outcome. And so here the outcome is acute cellular rejection, also known as acute rejection. But we want to try and make it specific to the kidney, so we include words like BAMF or biopsy. And what we say, we tell the exposure 1 that we want it to be 1 year before outcome 1. So this complete search is going to find patients that have words like acute rejection in a document or a comment, and then at least 1 year prior to the diagnosis of acute rejection, they have a mention of borderline change, and within 1 week after the mention of borderline change, they have been treated with steroids. And so I wouldn't necessarily certify that these are absolute results. This is that we're done with our investigation at this point. But when we put all of these in, we get 42 patients or so. And of course this has to be refined and has to be gone through by hand, but again you can see here's the patient, here's the exposure, borderline change, here's the date of borderline change diagnosed, here's the exposure steroids, here's the date of the steroids, and then here's the outcome, acute cellular rejection, and here's the outcome date. And all three of these dates should adhere to the rules that are specified on the search page. And that's where we are right now. Thanks a lot for listening.